Hey y'all, welcome back. This week on episode 11, we have Dr. Rocio Salas-Whalen, who is a triple board certified physician in endocrinology, obesity, and diabetes, practicing in New York. She owns her own practice, which she has been overseeing for the past 2 years, and she gives us all the ins and outs of what it's like to own her own practice. She shares her experience as an international medical student from Mexico and what her experience was like getting board certified and completing her fellowships here in the United States. She also shares all of the insight that she has about obesity and her opinion on the obesity epidemic. It is obviously a very difficult and challenging issue that we face here in the United States, but she does scrape the surface of it and imparts her wisdom. So I'm very excited to introduce her today and share a little bit of her story. So without further ado, welcome back for another episode. Today we have Dr. Rocio Salas-Whalen, and I'm very excited to interview her. I actually came across her Instagram page, and I saw she was a very empowered Latina physician, and I just had to ask if I could interview her. So I'm really excited to have her, and without further ado, can you go ahead and introduce yourself?
Yes. I'm Rocio Salas-Whalen. I'm an endocrinologist, and I'm originally from Mexico. I was born and raised in Mexico and came here after I completed my medical school in Mexico, actually.
Awesome. Okay, and we're going to go ahead and start from the very, very beginning of your journey to medicine. So when did you first know you wanted to become a doctor?
Very early on. It was one of those things that I always knew I wanted to be a doctor, and that's the only thing I ever thought of being when I grew up. So there was not a question of what am I going to be. It's just what do I have to do to get there, right? So it was something that I always knew. I always wanted to study medicine since I was little. I just always wanted to see how things worked. Like I always ask questions like, how does a TV work? How does medication work? How can medication make you feel better? And it was just understanding that I wanted to.
Yeah. Did you have anybody in your family or in your close circle that went to medical school or was a doctor?
Nobody. I'm the first one in both of my families, of my father and my mother's side. And we have a huge family. Even now, I'm still the only one. So nobody was it before and not after me. So I'm the only doctor in the family, yes.
Wow, that is amazing. It's kind of similar on my side, except I have one physician on my dad. My dad's brother is an anesthesiologist, but he doesn't practice in the United States.
Oh, is he in Mexico?
No. We're Colombian, but he practices in Spain.
Oh, wow. Cool.
Yeah, so very limited physicians in the family. So I understand the pressure.
Yeah.
Did you have any Latino physicians or Latina physicians when you were going on your journey that could provide mentorship at all?
Unfortunately, I didn't. I mean, when I went to medical school, I was in Mexico, right? So we all were Mexicans. But when I wanted to come to the United States, I didn't have somebody that I could reach out and ask questions, right? And how did you do this? What are the challenges that you can encounter as coming from Mexico here? Mm-hmm. So that's why now that I'm here, I remember myself being in the other side and not having anybody to guide me or tell me how to do things. So that's why I'm always open to helping and answering questions on Instagram and posting about my journey, because there's not that much information, especially for us Latins, right?
Yeah. And so you kind of told us a little bit how you went to medical school in Mexico. Can you tell us a little bit about what your process was applying to medical school? Because it might be a little bit different from the United States process.
So I think it is different. In Mexico, we go straight from high school to medical school. So pretty much in your last year of high school, you have to know what you're going what you're going to do, because you just go either to law school, medical school, engineer, architecture.
Okay.
But for us, it's 7 years of medical school. You do 5 years of school, 1 year of internship, and then 1 year of social work, which is pretty much working in an underserved area as a physician of that place. So it's a 7-year process. So I think it adds up almost the same amount of years as here in the United States and over there.
Okay, yeah, that's very similar to what it's like in Colombia as well. But I'm always like shocked to see people go in right after high school, because in the United States, a lot of us graduate and still have no idea what we
Yes,
want to
and
do.
I mean, I can see that, right? I can sympathize with that, because at you're 16, 17, we don't know much back then.
Yeah. So what did you think when you were in medical school? What was the hardest aspect about medical school for you?
Yeah, I think it was just adjusting to a new lifestyle, right? To adjusting of I don't want to say a lonely lifestyle, but a less social lifestyle.
Yeah.
We can say that, right? I mean, I was used to going out a lot with my friends, and then it was eventually, oh, I have to study, and every time the phone started to run less, that's how I describe it, to the point that I didn't get invited anymore, because I was always studying. So it was the sacrifices, I think, also either missing birthdays, missing Mother's Days, or just studying. I think for me that was a little bit the hardest part. I mean, there's a lot to study and a lot to take in, but giving up that aspect was, I think, a little bit hard for me.
Yeah, I never thought about it like that, because I feel like when you study, it's like, you know, you're going to get through the material, you know, you're going to have to pass the exams, but I never really thought about how much I've given up, I guess you could say. So that is a good way to put it. That is a very
It's also, it's different from there than here, because when I was in medical school, I was living home. I was living with my parents. It's not as common that you leave for medical school or you leave for college, right? You pretty much until your parents' house until either you finish your career or you get married.
Mhm.
So maybe that's why I was more exposed to missing certain important dates or family dates, right? Because I was living at home.
Yeah, I guess I kind of gotten used to it, because I went away for college for 4 years, and then I went away for grad school, and now I've been away for another 2 years. So at this
Yeah.
point, it's already understood that I'm only coming home for Thanksgiving and for Christmas. So I definitely understand that.
Yeah.
And I saw your post. So you talked a little bit in your post about when you opened up your practice, and you mentioned that you took the USMLE, you studied for the USMLE for 3 years. Can you tell us a little bit about what the process is like, doing the boards as an international student?
I think as an international student, the major difference is that we do the boards after we finish medical school. So it's like, I felt like I restarted studying medicine again from the beginning, right? Because I had finished my medical school. I was even practicing before I came here. So going back to biochemistry and anatomy and pharmacology, I felt, which was great. Actually, I enjoyed it, because I always enjoyed like studying medicine, but it did feel like I had to restudy medicine all over again, right? And it's not just that, also the language is different, that the social English is very different, or I knew it more than the medical terminology, right? So I remember having my Kaplan books, and then English, Spanish medical dictionary next to me, and going to the words and saying, okay, this is how you call this. And so that's why it was a little bit longer than probably if I'd done it through medical school. Now, what I always tell international medical graduates is, if they have an idea of coming to the United States, to do the boards as soon as they're in medical school, because then you're studying at the same par as what the subjects of the first USMLE is. So we have the same itinerary in classes, right? So we start with anatomy, we start with biochemistry. So it's the USMLE 1, and then I think that's the best time to do the exams is while you are actually in medical school, right? But
Yeah.
many of us are not aware of that, or we don't know that we can actually do that while we're studying medicine. So it's after we finish, and then it's relearning again medicine in another language. So
Yeah. Well, medicine itself, I speak English, Spanish was my first language, but I'm very fluent in English. And for me, I Google things still. So I can only imagine translating from Spanish to English.
and then like the pronunciation of certain things, it took me a while for me to like to not to pronounce how I read it, right? Like, because that's very Spanish, like how you read it, you pronounce
Yeah.
it. It's very different, right? And while I was studying for my boards, I was lucky enough to work with a dermatologist in Miami.
Okay.
So that really helped me to also to get more comfortable with being with patients in English, right?
Mhm.
Because you come from Mexico and were a fully English speaking patient, it can be intimidated, not because you don't know the knowledge, because of the language, right? Or because of the you're afraid of how you're going to pronunciate things, that they're not going to understand you properly. So practicing a little bit with a job as a medical assistant helped me, I feel, a lot. So
Okay.
that's also something that I always tell, if you can get like any work in a lab for some research, any labs here, they always need somebody to help pipette or something. So if anything you can get your toes wet in some medical either practice school lab here in the United States, I think it also is going to help you, and it helps put it in your CV at the time of applying, right?
Yeah.
They're all looking for some medical American medical experience, anything.
Okay. And I know, so you did medical school. So technically you were a doctor when you were studying for the USMLE, correct? How did you feel working as a medical assistant? And like, I'm sure you had medical assistant pay. How did you feel being a physician, being at that level?
That's a very good question. For me, the way I saw it is, it didn't matter how I got there, as long as I got there.
Okay.
So for me, I had a bigger vision, right? For me, it was a bigger price. So if I had to work as an MA and the reason that I had to work as an MA was to get a visa to stay here in this country, because I'm not a US citizen. Well, now I am, but when I came, I wasn't. I came with a tourist visa. So I needed a work visa to stay here and study for my boards. That's one. And second, because I needed the income, right? I needed to pay for my apartment, for my books, for the car that I had. So I needed to support myself. Basically, if my parents could have helped me, they would have, but they couldn't. And I couldn't impose that, right? So I said, okay, I have to find out how am I going to make a living and be able to study and stay here while I study. So I had to put my MD title in my back, leave it there,
Yeah.
and get me out of that mind of, oh, I'm the doctor. Why are you telling me that I have to go and draw the blood pressure?
Yeah.
Because at the end, I wanted something bigger. If it would have been different if I said, okay, this is what I'm going to do here, right? I could have been a doctor in my country, and I want to come here and I'm going to do MA level services, or then I think it would be different. But for me, it was just, I always saw it as a bridge to get where I wanted to get.
Yeah, that is also very like humbling. So it's very eye-opening to see that you were able to.
And you know what? It helped me also to be a better boss now, because I was on the other side.
Yeah.
I was not the doctor. I was listening to the doctor, and I remember how he treated us, and he was a great boss, and that helped me also be on the side of the employee and see how it feels to be on the side of the employee, the things that you need, the things that you want to hear, the things that you don't want to hear, how you want to be treated. So I feel like all of that, it helped me in many ways, and I'm applying it now as I have my own personnel, right?
Yeah, that's awesome. And so when you were taking, did you have any challenges aside from the language barrier and, having to work while putting yourself through the board examinations? Did you have any other difficulties passing the boards and getting your certification?
Well, passing my boards, I didn't pass my step 1 the first time. It took 2 times, and it was just the understanding of how much I needed to dedicate it to it, right? I feel like as a doctor that I came, I said, oh, I'm just going to take the test and I'm going to know I said, oh, I'm just going to read the first aid and that'll be it. And then you go and you realize that the questions are not yes or no, right? I mean, they're what they call the clinical cases, the vignettes. And then I almost feel like you have to go 3 steps back. That's what they're trying to find out, I think, the boards, that you truly understand the concept and then that you apply it, right?
Mm-hmm.
So the first time that I did the exam, I didn't study much. The second time, I took it as a full-time job. I always said that my medical assistant job, even though it was a full-time job, that was my part-time job. And getting out of there and going to study in the library, that was my full-time job. So I didn't pass that time. And then I think also challenges was for applying for residency, right? So one thing I learned is that it's not just passing your boards and then boop, you have a open spot for you, right? And that's what many of us think at the beginning. Oh, you just need to pass your boards and then you're in. And then you pass your boards and then you realize like, oh, well, what do I have to put in my CV? I need letters of recommendation. They're asking me for some research. So that was also very challenging. So every step was challenging.
Yeah.
But whatever I tell people that are studying or coming abroad is that don't get overwhelmed by the big picture, right? It's always like have like a horse vision, right? That just one thing at a time.
Mm-hmm.
Complete one step at a time, do one board at a time, one application at a time, because if we're thinking already of the end, we're not gonna make it, right?
Yeah, you're gonna be flustered. So when did you know that you wanted to do endocrinology and internal medicine? Can you walk us through that whole process?
So, I think the first disease that I ever heard was diabetes.
Okay.
And that's because in Mexico is the #1 cause of death. Diabetes, actually, more vehicle accidents or cancer is diabetes. They said 3 out of every 5 Mexicans have diabetes. So it's I was always exposed to it. I growing up, my paternal grandfather passed away from diabetes. My aunts and uncles have diabetes. So it was almost part of the conversation in a Mexican family, diabetes. So going into medicine, I wanted to learn more about diabetes. And when I took my endocrinology classes, I fell in love with the axis, with the hormonal axis and the pathways.
Okay.
And I said, well, how lucky that that's diabetes. That's a specialty for diabetes, right? Endocrinology. So I actually went into internal medicine because I wanted to do endocrinology.
Can you walk us through your process of like your whole residency? Like how many years did you do internal medicine and, where? What was it like also, if you could touch upon, what was it like being an international resident or being an international student and being merged with American residents? Did you ever feel out of place or feel like
of course,
imposter syndrome, anything like that?
Yes, I mean, yes. I did my residency in Jacobi Medical Hospital, which is part of Albert Einstein in the Bronx in New York. And I remember, because I always knew I wanted to do endocrinology, right? I mean, I was halfway medical school when I realized I wanted to do endocrinology. So applying to internal medicine with hospitals that had a fellowship of endocrinology there, right? I wanted to like build myself there so they would know me and be easy for the application for fellowship, right?
Yeah.
So I remember on my first year of residency, on my first 2 months as a resident, I went with the program director of endocrinology and I told them, this is who I am. My pursuit is to do endocrinology. And I want you to tell me what is it that I need to do to be able to apply and stay and get a fellowship spot, right? And he looked at me and he said, well, you already have 2 points against you. He's like, you're a foreign graduate and you have visa issues. And that was like on my second month of my first year of residency, right? And I remember having co-residents tell me, you know what, you're never going to get a fellowship and it's because you're an international graduate. Don't take it personally, but it's going to be very hard. And it was. I actually, when I applied for fellowship, I didn't get a spot anywhere. I got an interview in my hospital and I feel like they gave it to me because I was always there and I did my research there and I was like in the ground rounds of endocrinology. I knew all the endocrinologists. They knew I wanted to do endocrinology. and I didn't get a spot anywhere. But, I always say it's hard work and luck, right? One day I opened my computer and there was an open spot at University of Maryland of endocrinology that a fellow that had accepted, I think she was pregnant or something, and left the spot. So I sent my application immediately. And this is also the hard work. I was always going to conferences to network, right? To network and meet people. I went on a Sunday morning to a conference at Columbia University. And I remember thinking to myself, I said, what am I doing at 7 a.m. on a Sunday in a conference? And the first slide, it was going to be a talk given by the program director of University of Maryland Endocrinology Fellowship. So when I saw it, and I had just sent my application the week before, I said, wow, I said, you have to put yourself in those situations, right? I mean,
yeah.
If I hadn't gotten there, when he finished his talk, I went up to him and I talked and I said, oh, and by the way, we talked about the interest of endocrinology. And I said, by the way, I sent my application last week to your program. And he said, oh, great. And the next day they called me for an interview. And 2 weeks later, they offered me the spot.
Oh my God.
I remember exactly where I was, what time it was when they called me and they told me if I accepted the spot. And I said, yes. So I didn't have to wait another year and do all the process again, thank God. So that's how I got to do my fellowship.
That's awesome.
So,
how many fellowship programs would you say you applied to when initially?
Maybe like 10 or 15.
Okay.
I wanted to stay on the East Coast.
Okay.
So I think the farthest I went was probably maybe Texas, but I wanted to stay more northeast area.
Awesome. Oh my God, that is insane. An insane story. Like, what are the chances?
But you know what? And yes, I remember walking in the hallways of that hospital, University of Maryland, and saying, how did I get here? And that's imposter syndrome, right? But I always think imposter syndrome, it's good. It's not bad. It's good because it keeps you on your toes. It keeps you challenging you. It keeps you reminding you that not to lay comfortable in your laurels, like we say in Spanish, right? It's just, you have to keep going. You have to be proving yourself, right? I like it because I feel like it keeps pushing you to not get comfortable and say, oh, I made it. I'm the best here. No, we still have a lot to learn, right?
Yeah, medicine does a very good job at humbling you just when you think like you're set.
Totally. So, many aspects. I mean, from your health, right? You value your health. You value your family. Seeing other people suffering or having health problems. I mean, it humbles you in many, many, many ways.
It really does. And you're triple board certified, correct? How do you keep up, how many fellowships did you have to do, or, what is the process of maintaining those certifications?
So my first board was internal medicine, and if you complete your residency of internal medicine, then my second board was endocrinology. And then my third board was obesity. Obesity medicine is something relatively new that actually now there's a fellowship. When I applied for endocrinology, it wasn't there yet. So I think endocrinology, diabetes, and obesity go hand in hand.
Yeah.
So when the board was, the American Board Association of Obesity Medicine came up and you could be certified. I studied for the board. I did all the requirements. So for the Board of Obesity Medicine, there's two pathways. One that you can do 1-year fellowship, or one that you can complete certain credits and then doing online test and then applying for the board like any other person, right? So okay. I took the pathway of not doing the fellowship because I already had done my endocrinology fellowship. So that's the way that I did it. And yes, every 10 years you have to renew your board. So I'm actually up for my internal medicine board, and then 2023 I'll be up for my endocrine boards, and then 2028 my obesity. So it's always like, it doesn't stop, right? The studying doesn't stop. You always have to be to the next one.
Wow. Well, at least it's not all in the same year.
I have it staggered.
That's perfect. You have been in practice for 2 years now, about 2 years, correct?
Well, I completed my fellowship in 2010,
Okay.
so I've been practicing since 2010. But my own office I opened last year.
Oh, awesome. Yeah, that's what I was referring to, your own practice.
In my own
How
office.
how has that journey been opening up your own practice in New York? And my other question was, what does your everyday look like as a owner of a practice?
You know, one thing that I would say for medical students, for you, for residents, is that unfortunately we don't get teach the economic part of medicine in medical school, right? We're so concentrated on, and as it should be, in the health and making the patient healthy and diseases. But this is still our job. This is still how we're going to pay our bills, and this is still our income, right? So it's a shame that we don't get teach the economic part of medicine. So I always tell anybody who's close to finish is just to learn a little bit about the business side of medicine, because it's still a business. It's still your job, right?
Yeah.
That we would do it fully, even without payment, but it's a job that we chose, right? It's the only income unless we have something on the side, which most of us cannot.
Mhm.
So when you're in residency, when you're in preparation, you always hear that, I don't know, private practice is dead, or private practice doesn't work, or private practice doesn't sustain itself. So you come up thinking, oh, I have to belong to a hospital, I have to be part of a hospital group or a big group. But then you realize when you're out working that there is private practice, and the people that are working in private practice love it and they're happy, right? So I do feel like since I opened my own office, I'm the happiest that I can be. I can go back, I can come back to work happy, right? Looking forward to it.
Mhm.
And not thinking, oh, how am I going to have 30 patients to see today? And that you start great, and then halfway in the day, you're like, oh, I still have more 15 patients to see and do my notes. And you get so overwhelmed that you can lose a little bit the spark, right?
Mhm.
Or the joy of medicine. So since I opened my practice, I knew I wanted to take my time with patients. I knew I didn't want to be rushed. I knew I wanted to have a conversation with the patient, look at their eyes, and build a relationship. And I feel like when I used to work for another group or belong to a hospital group, I couldn't afford to do that, right? I would have done my job well, but I couldn't create a relationship with the patients because of the time, right?
Yeah.
So for me, that was it depends on your priorities, right? In what you want to do. But for me, it's building that long-lasting relationship with the patient, that they become like part of your family. And for that, you need time. You need to spend time to earn their trust. In
Yeah.
a 10-minute, 5-minute, it cannot happen, right? So for me, that was important. So I see that now, that I can control how much time I spend with my patients. I can control how many patients I see per day.
Mhm.
If I want to add somebody at the end of the day because they need to be seen, then I can do that. I don't have to ask permission, or, if I don't want to, if a patient cannot pay for their visit, and I want to say, okay, well, you don't have to pay today. I can do it. Before I couldn't,
Yeah.
right? It was not in my office. And I have 2 kids. So if I want to pick them up from school, then I can stagger my patients, that I have a free time to go and get my kid from school or drop him in the morning, right?
Yeah.
So it's having control of your time.
Yeah, and that's awesome, because I feel like the specialty that you're in, like obesity and endocrinology, there's a lot of chronic conditions that require that extra,
Yeah,
push and education for the patient.
especially obesity and diabetes, right? That is so much of lifestyle, that it's what we do in medication is very little to what the patient has to do outside to
Yeah.
control their disease. And I feel like you need to have that conversation, and you have to talk about their lifestyle, their exercise, their diet, their family. It's very complex. They're multifactorial diseases, right?
Yeah.
It's not just one thing. So that's why those diseases deserve the time that I wanted to give the patients.
Yeah, you really have to invest. You can't just like toss medicine at them or
And
anything.
I always say, the more informed the patient is, the better he does.
Yeah.
So it's teamwork, right? So you have to educate the patients about their disease. You have to teach them what they need to know about their disease, because I always tell my patients, the moment that you leave the door of my office, it's you. So that's going to be on their own. So you want to educate and you want them to have the knowledge to treat their disease. And I feel those patients, when you dedicate your time to do that, the patients will do better.
Yeah. So of course you're from Mexico, so you're bilingual. And you mentioned that a lot of Mexicans are affected by obesity and diabetes. How does your background help you in serving these populations? And do most of your patients speak English and Spanish? Do you use your Spanish in the clinic?
I do have many patients that are Spanish speaking, not just from Mexico, but from different parts, from Spain, from South America, and also from Mexico. But I think what it helps me regarding obesity and diabetes is the cultural background, right? I know our cultures, I know our diet, I know the type of food that we eat, and I also know the Latin America culture of eat, you're too skinny, come on, eat, or it's like we think certain weight or eating certain way, it's equal to health, right? Versus if you're taking care of yourself or watching what you eat, it's not well seen. So I think those things I can relate exactly when talking about diet, right? Because I know what their diet is, and I know what the family, the abuelita is saying, no, you have to eat more, you're not eating, or so it's talking about all of that. I can relate to what they're going, so the struggle that it is, right?
Yeah, that's definitely been a struggle in my life because, as I said, I'm Colombian, so my grandma's exactly like that. And my mom and my dad, may not have the best diets, and they don't. My mom always says, like, in Colombia, nobody had a gym membership. Nobody was obese. You always walked. This was never an issue. The whole dieting thing wasn't a thing. Everybody was just, not obese and not having to deal with these diets and fitness because it just was ingrained in the lifestyle.
But also I think the diet that our grandmothers had is very different from the diet that we have now. And that's because food was more natural back then, right?
Mm-hmm.
I feel like they're so genetically modified, the pesticides, the growth hormones, the antibiotics, the food is made, the quality of the food now is different.
Yeah.
So yes, I do agree that they used to eat a very complete diet and not have the obesity that we have now. But I also think the quality of the food was very different.
Yeah. And so I guess I have to ask because, you're an expert literally in the field. So what is your take on the obesity pandemic? And, do you ever believe it'll get resolved?
So I do think that we can, first, for us to resolve obesity, we have to understand what obesity is.
Mm-hmm.
And there's a lot of misconceptions that we have about obesity. What we normally would teach or thought, not as a physician, but just as general population, is that obesity is a lifestyle problem, right? It's a behavioral problem. It's, that person cannot control how much they're eating. They cannot control themselves. They have no self motivation to go and exercise. We always attribute it to something lack of the person, right? It's like a failure for the person.
Yeah.
Because of that, it carries a lot of stigma, right? So it's very hard for patients to bring the subject to their physicians because they think they're going to be judged, that if you could have done something already, right? Or why are you not doing something about it? But obesity medicine has changed significantly in the last 10 years. We have a new concept of obesity. We see obesity as a disease, as a true disease. It's not a lifestyle problem, it's a disease. And the WHO actually recognized obesity as a disease since 1943, but it's not in the US. It was not until 2013 that the American Medical Association accepted to recognize obesity as a true disease. Mm-hmm. So when we see obesity as a disease, then things change, right? Because when somebody comes with high blood pressure, you're not judging what the person is eating or not doing, right? We treat it. Right? Diabetes also, yes, there's some lifestyle, but we treat it. We don't judge the person. And with obesity, we have to change that. We have to understand that it's a chronic disease. It's not purely and solely a lifestyle problem. We know there's environment causes for obesity, and I'm talking about growth hormones and the food, pesticides, toxins, the toxins in the environment, the industry, all plastics, all of that do contribute to it. It changes our chemistry in our body, and they do contribute to obesity. Then we have genetic factors, right? So there's families, genes that people are predisposed to gaining more weight and to develop obesity. So if you think of genetics, environment, and lifestyle, then just by changing the lifestyle, we're not going to fix the problem. And that's what we've always been doing. Eat less, exercise more, come and see me in 6 months, and nothing would happen. And then the patient gets frustrated, we get frustrated, and we stop talking about the problem, right? Because we were not helping. But now we have help. Now we understand obesity as a chronic disease, so we can treat with medications, right? And it takes time for the physicians, for the healthcare industry, and then for the population to accept to be treated for obesity and not see it as a failure, right? Like, oh, I couldn't do it on my own. Oh, I could have lost it on my own if I ate less or I made better choices. It's not on them. It's not on them anymore. So the medications help control how much we eat, what we eat, our cravings. So we have medications that help for obesity. We just have to be open to treat obesity as a disease, right?
Yeah, that is very good and thorough, and helps me understand, the whole epidemic and stuff like that. And I know now in medical education, they put a big emphasis, at least at FSU where I'm at, about the social determinants of health and how that plays a role in people developing these chronic conditions. Like you said, it's not always their fault, and we shouldn't put the blame on them.
And the thing is that we've been so used to treating the consequences of obesity, right? We're very comfortable with treating all the consequences of obesity, which diabetes, high blood pressure, heart disease, high cholesterol, joint problems, arthritis. We're very comfortable in treating all of that. But now we can actually treat the root cause, which is the obesity, and avoid having to put the patient on a 10 list medication list for different things, right? So it's just going, it's going a little bit back and seeing it as treating the root cause, versus waiting for all the complications to happen. A lot of people say, oh, but why are you going to put me on medication for weight loss? Yeah, but I'm avoiding you putting you on medication for diabetes or high blood pressure. And even when the patient comes with all of that already, and when we treat the obesity, their medication list always shrinks, right? I always tell them, as your waist is going to shrink, your medication list is going to shrink. Because now we were just patching. Now we're actually treating the true cause of all those other chronic problems.
Yeah, that is very good. Thank you so much for that whole explanation. And then my last question kind of leads us into like a nice summary. So we talked a lot about a lot of different things. So your journey, being a Latina, your the challenges you faced in applying to fellowship and all that in between, and of course, obesity in general. So if you could offer from your thorough experience getting to medicine, what 2 golden nuggets or words of wisdom do you have for another student or Latina or minority that wants to pursue medicine? What advice do you have for them?
So I think discipline and determination are the main pillars of studying medicine or becoming a doctor here in whatever other country. You have to have the discipline to study and to be a doctor, right? I think it cannot happen without that, I feel. And the other tip that I would give is always like have short goals, right? Have short goals to pass your first exam, to finish your first year. Once you do that, okay, what's my next goal? Because if we try to take the whole bite of the cake, I feel like we get overwhelmed, right? And I'm like, oh, I'm not going to do it. So always have short goals. Have short goals and do those one at a time.
That is so good. And I think you did a really good job of showing us of how you like implemented that in your own life, because Lord knows that if I was given the journey that you had, I would be so overwhelmed, but you handled it with such grace.
Yeah, it is. And I look back and I said, oh my goodness, would I do it again? And probably I would. But I think what helped me the most was just concentrating on one thing at a time.
Yeah.
And but never losing sight of the big prize, right? That all of that was just one step, getting me one step closer to where I wanted to go.
Yeah.
The problem is when you stay comfortable there, right? It's always like, okay, I have to do this for the next thing, for the next thing.
Oh, well, thank you so much for, taking the time to speak with us and provide us with such awesome insight and just being a living example of what it takes to be, an empowered Latina in medicine. Oh, it's been awesome.
Thank you. Thank you for inviting me.
No.